Hi, how are you today?
I'm good. How are you?
Good. How's Ashley?
She's good.
Good. So we're here for your 4-month baby check.
Yep.
And do you have any questions you'd like to ask before we start?
Yes, I had a question about lead poisoning. I saw on the news some toys had been recalled, and I was just kind of curious about how a baby or any children can be exposed to lead poisoning.
Okay, well that's a really good question because a lot of people aren't real informed about it. But it is the #1 environmental hazard for health in children in the U.S. And in 2000, there were 890,000 to 1 million children diagnosed with lead poisoning. The ages are usually 6 and under, but they do cover older ages, and it can also affect pregnant mothers because it crosses the placenta barrier. So there are a lot of factors to take into consideration on this.
Oh, that's great. But how does my baby get exposed to lead poisoning?
Well, like I said, it can affect the fetus by crossing the placenta barrier, and also the highest risk is 6 and under. And they can get it by ingesting, inhaling, and absorbing lead through their skin. And the ways that it comes about is houses that were built before 1978 have lead-based paint in them. After 1978, lead-based paint was banned, but that still causes problems nowadays with peeling paint and dust from lead-based paints. Also from toys that have been imported that have not been regulated correctly, and from jewelry that has not been regulated. And also from soil when playing outside has sometimes been contaminated with lead.
So what does lead do to a child's body?
Well, once the lead hits the bloodstream, it inactivates enzymes that compete with calcium, which are for development of bones. And it also interferes with nerve transmission and also brain development. And over time, this buildup of repeated exposure builds higher levels of lead in their system.
What are some of the signs and symptoms of lead poisoning?
Well, some of the signs and symptoms are abdominal pain, aggressive behavior, anemia, constipation or diarrhea, difficulty sleeping, irritability, loss of previous developmental skills that are noticed more in babies, low appetite and energy. And then the possible complications that can follow with that is behavioral and attention problems, say with children in school, a failure in school. They can also have hearing loss, and kidney damage, reduced IQ, and slower body growth.
So what are some of the tests that you do to test for lead poisoning?
Well, one of the easiest tests we can do is a simple blood test to test for the lead, and also a CBC, which is a complete blood count. We also do coagulation studies, bone marrow biopsies, iron levels, and also we may take x-rays of the long bones to see if they've affected them in any developmental reason, and also the abdomen, because sometimes we can see if there's paint chips or maybe they swallowed like a lead weight from fishing items. From the blood test, we can find out how much lead is actually in the child's body. Normally, it should only be 0, but acceptable ranges are from 0 to 9 micrograms per deciliter. It should still be watched at that point. If it goes over 10, you should have additional lab tests to determine the extent or damage that the lead has done to the child. If it goes higher than that, it's considered an emergency, and then there are medications available to help excrete the lead out of the body system.
So what's the treatment for lead poisoning?
Well, we like to use a drug that's called succinylcholine, which is a chelating agent. What it does is it treats the lead poisoning by forming a water-soluble compound with the lead and allow it to be excreted in the urine. And the action is that it decreases the blood levels of lead, and it also decreases target organ damage in lead poisoning. Some of the side effects are cloudy filmed eyes, otitis media, arrhythmias, and pruritus. The treatment is taken orally, and it takes a 19-day procedure.
So what are some ways to keep my child safe?
Well, there are some easy things to do. First of all, you want to keep your house as dust-free as possible. You also want to wash your hands before eating, and keep them away from old toys and throw them out. And toys that you question, you can always go onto the CDC on the internet and find out what toys have been recalled. You also want to make sure that your tap water isn't coming from lead pipes or any type of lead soldering. You want to avoid canned goods from foreign countries, and you want to make sure that your area outside is safe from any contaminations of lead. So, do you have any other questions?
Nope.
Well, let's see your baby and
Check her out.